Hello, Elias. Thanks for joining us today.
Good morning. Thanks for having me.
Well, thanks. As we get started, would you please share your name, your company name, and your role there and where you're located?
Yeah, sure. So my name is Elias Moran. I'm the owner of Confianza Health, along with my wife. We operate here in Arizona. We have a office in North Phoenix, and we're opening a new office location in Avondale. So we're very excited about that.
That is exciting. What led you to establish Confianza Health?
Oh, well, I'm a therapist by trade, so I practiced for a long time until I decided that I just wanted to try and do things a little bit different.
What kind of programs and services do you provide at Confianza Health?
So we first started out just providing the individual therapy, family therapy, and I did all that when we first started. I did all the therapy, and then when my wife and I started working together and building the practice, then we were able to start expanding on those services, which now we offer groups, we offer skill building groups, classes, parenting classes for parents, um, and a number of other services that we provide now that we've grown to the point we're at now.
And have you found that there are any challenges or factors that are unique to providing healthcare in the state of Arizona?
It's been a very eventful journey. I could tell you that. I think one of the biggest challenges that I did not anticipate was getting into the field as a agency. I think I kind of took that for granted maybe a little bit, and didn't know. I went in blind, kind of didn't know what that entailed. I think I would probably do it the same, knowing how much is involved with becoming an agency instead of more of just a solo provider. So I think that's been a big challenge that I didn't quite realize um, when we first started.
Is your community supportive and receptive to the services that Confianza Health offers?
Oh yeah, absolutely. That's been our kind of halo, I guess. I don't know how else to put it, but when we start going out into the community, we did an event this weekend, and we're just always amazed of the overwhelming both support and need that there is out there for families.
How do the individuals who need your services find you? How do they locate you?
Yeah, no, a number of different ways. Of course, we're set up with both our Medicaid system, our state-run access program here in Arizona, and
Mhm.
that's crucial because we're able to provide a lot of the services that we would not be able to with our commercial providers.
Hmm.
But they can find us, and through each of the individual insurance providers. But we also have a marketing um, our marketing platform and avenues that we use to promote.
Hmm. So, what makes Confianza unique?
Oh, well, I guess I would have to say our approach. I feel like, from the very beginning, our mission, our vision was to approach treatment differently,
Hmm.
to approach treatment in a way that people, and I know this might sound cliche, but it's just real when you start really treating people like their family, like you care about them,
Hmm.
like you're invested with them. It just makes all the difference in the world. And so that's what we really wanted to provide. We really wanted to focus on being able to do that while providing the services that only the big agencies are able to provide.
Hmm. So, you've been documenting and billing at AZZLY since 2020, and I believe I've been your senior implementation specialist since then.
Wow, That's a long time.
It is. Do you remember what you were using before? Was it an EHR and another billing system, or was it a hybrid paper and billing system or payer portal?
I don't. Let me try and think. I don't think I remember what EHR we were using before. Um, and I know that it was something that was not meeting our needs. So that's why we started looking around. Because we always had this vision of growing the agency. That was perhaps one of the biggest driving considerations when I was looking for another EHR. Something that can grow with us. I
Hmm.
think when we first started in 2020, it was just me.
Yeah.
So I didn't have other providers. We didn't know how to bill for another provider. We didn't even know what supervised billing was. I had no idea. I knew nothing, which was both a good and bad thing. Um, but yeah, we when we first started, we did not. We did use another EHR that did do electronic billing, but
Hmm.
we couldn't get anything set up with them. It was there was a lack of communication between the EHR and ourselves. So and the services is that they provided, the the services that they provided were not inclusive enough. They weren't able to um, satisfy what we were trying to do.
Hmm. So
And
what
it,
about Asley got your attention?
yeah, it took me a long. So I looked for a while before
Mhm.
we landed on AZZLY, and what we really wanted, I think the main, like I was saying, the main consideration was finding somewhere that could really grow with us. Um, of course, we're a small business, so I love that. I love that aspect also about AZZLY. It, I think, aligns with our model, and so somewhere that can really grow, but also that can support us, because I knew I needed a lot of support, because I did not know anything about billing. I've never been a medical biller. Um, I've never done anything with health insurances. I was just a therapist.
Mhm.
And so somewhere that both would be able to allow us to grow, have the structure in place that we can expand, have the support that I needed, and have the services that I knew we would be needing in the future.
Right. Is there something now about Asley's features and functionality that makes you stay?
Oh yes, absolutely. So we are in the process of implementing the patient portal.
Hmm.
That's huge, because one of the main necessities we have to have as an agency is things have to have a good workflow. There has to be a good structure. And so
Hmm.
the patient portal is really going to enable us to do that. It's going to be more streamlined. It's going to be less confusing for our members.
Hmm.
So that's a huge benefit that we're still in the process of rolling out, and we're excited for it.
Right. And so you mentioned some challenges about needing to learn how to do billing and how to run your agency. Has Asley been able to help you with those challenges?
Oh yes, thank you a million different ways to Joyce. Joyce has really helped me understand, walked me through, taking the time. I feel bad when I'm bugging, not just Joyce, but everybody. You, Traci, everybody's always been so helpful. I call and I just say, "This is Elias," and "Hi, Elias," and it's great. I love it. I try not to bug, because I know that you guys have other providers and I'm not the only one. But there's, yeah, no, the support for every aspect. But the billing side, w- we would not be able to build at the level we're at right now, and
Hmm.
it's just gonna double in this next year,
Right.
if not triple. And so we really needed to have something that a structure and a system and the process and workflow set in place. That way we can handle that growth.
Right. So I know that you mentioned the patient portal, and you've been with us since 2020. Is there any other features that we added along the way that you found useful?
Um, I I think the ease of use is a huge factor when we do our onboarding training. If someone has even a little bit of concept of how systems work and computers work, they're able to jump in there and start using it without a problem.
Mm-hmm.
Everything's very intuitive, and we're also able to. It's very customizable. We have a lot of forms. We do a lot of our services that we want custom forms. We want specialized kind of workflow and processes, and AZZLY is able to accommodate for that.
So you mentioned that you have a new location that you're opening, which is also very exciting. Has AZZLY been able to help you with that? Is the new implementation of the new location been seamless, or have you had any challenges with that?
Yeah, so we're in the process right now of getting that established. That should be opening up in May, June timeframe. And with that, we're going to be really starting to use. We're really going to start expanding our group services.
Mm.
So we have been in the kind of final stages of making sure everything's going to be working correctly, everything's going to be flowing correctly,
Mm-hmm.
from the billing to the documentation. So that's something that we're really excited about, and every kind of question that we have that comes up for that, Traci, because I've been bothering you. I've been asking
Not a
and you're
bother.
getting back to me, and we've been really been able to iron out those kind of questions.
Right. All right. So overall, tell me about your experience with the client services team. That would be me and my team, and also include what you have experienced with the billing and claim support.
Sure. The all the support that we've received, I'm very happy about. Um, even our staff, they have things that come up, and they've been submitting tickets and getting those addressed. The response time is within the same day, which is pretty amazing. The so there's I'm always very happy about our support with AZZLY. There was a period where I don't even remember what the situation had been, but Joyce was right there with there's a problem with the billing, and Joyce was right there and ready to submit our claims, and we have a lot of claim. I mean, for us, it's a lot of claims.
Mm-hmm.
When we were meeting with her, and she was, I'll take care of all the claims. I'm going to make sure that you get your claim submitted out. We were just amazed at the level of you know devotion, consideration and care that everyone
Mm-hmm.
has shown to us.
Has there been anything that you wish we did better, or that we provided that we don't provide?
Um, I guess, how would I say, we've been really happy with AZZLY. Um, there are always, I guess, in business, we're kind of new to business, so there's always things that come up that need to be addressed.
Mm-hmm.
So I don't really expect that to be different, if that makes sense. I expect that there's always going to be things that come up, and so what I kind of gauge, our you know consideration for success, or what we like or don't like, is how receptive our partners are with addressing our needs. And our partners are very receptive, which AZZLY has been, and on top of trying to get these situations resolved, that's all that I guess we can. That's really what we really want to look for when we're looking for working with a partner.
Great. So lastly, before we wrap it up, is there anything else about Confianza Health that you'd like to share?
Wow. I mean, I guess I just like to say how grateful we are that we're able to provide these services, how grateful we are that we've found partners like AZZLY that really are interested and invested in our success. And we're just so lucky to be able to do what we do.
Thank you, Elias. We so enjoy working with you and your staff. It's been a pleasure.
Thank you.